Please put your hands together in welcoming our honorable panelists on stage. Can we please have Dr. Guru and Reddy, founder and chairman, Continental Hospitals. Dr. A.V. Gurava Reddy, managing director, Kim's Sunshine Hospitals. Dr. Yedavalli Subramanyam, CEO, Apollo Hospitals International and Andhra Pradesh. Mr. P. Hari Krishna, Executive Director, Medicover Hospitals. And may I please invite the moderator of this session, Kalpana Sharma, Editor, Health, Times Network, to please make her way onto the stage. Over to you, Kalpana. The stage is yours.
Thank you so much. Am I audible? Okay. So, we are here and we have a very, very exciting panel today. Healthcare, as we all know, is standing at a very interesting juncture in terms of innovation, collaboration and growth. And who better than the esteemed panelists here to talk about it. So let's straight on dive in to this discussion. Dr. Guru Reddy, my first question would be for you. You've built Continental hospitals with a strong focus on quality. And, in your experience, how can we really leverage that kind of infrastructure at a low cost?
That's a wonderful question for the audience. I think the very premise of my transition from America was to focus on healthcare infrastructure, which was the biggest need for this country. My traveling across the country from 2007 to 9, before I embarked upon this mission, was primarily to understand what is required, what is ailing of healthcare delivery in our country. So given that prerogative, I ventured upon to build, one of the best infrastructure-oriented, facility. Now, your question is that when infrastructure costs so much, how can you really maintain or control the costs in terms of care of the patient? Good. It is doable. It is very doable. And I'm going to just expound on that if you give me about 60 seconds or a minute or two.
Please take your time.
Yes. So from the get-go, when you design an infrastructure, then you need to have a clear vision and a mission. So my vision and a mission is and was, at the end of the day, can I really focus on the human resource that we can train in terms of what constitutes a quality delivery of healthcare? Okay. Number two, can I really have a group of doctors or the entire faculty who can marry that vision and mission, who essentially envisage that quality delivery at the end of the day is not only something that is required, but what it means to the patient in terms of, their progress and recovery. And last but not the least, in any venture in healthcare, quality assurance has to marry with quality delivery. These are two very important terms. By quality assurance, we talk about infrastructure, we talk about human resources, we talk about technology. By quality delivery, we are talking about that human resource that you employ, where they are continuously trained to bring them up to focus on, what constitutes quality in terms of its delivery. If you can control these things, I have come to a conclusion. At that point in time, let me experiment in India that in spite of having advanced technologies and a great infrastructure, can we control the costs? And we have exactly proven that. One of the greatest example is we were labeled as 7-star hospitals, 5-star hospital, and a lot was discussed in the press. But I was the only one in the Twin States for an ultra-modern infrastructure where we have accepted to take the Arogyashri of the Telangana government from the very first day and the get-go. Because I had the significant experience in America how to manage capitated contracts. Given that experience, I've instilled that the process amongst the entire fraternity, not only the doctors and the nurses. When a patient comes to the hospital, be quick in your diagnosis. If the government has to give an approval, present to the government all the appropriate, indications that the government is demanding. Don't confuse them. Number 3, I appeal to the governmental person or bureaucrat who is responsible for Arogyashri. Can you please help us to sanction this at a very fast pace so that we are not wasting unnecessary days in the hospital? So a combination of all of these things, and then we had electronic medical records from day one. So there was no confusion. They had no difficulty in interpretation of writings. It was crystal clear. There was no changing of your diagnosis. So all of these things we have proven in my venture in 2013 and 14 that it is possible. If we can take what the government was offering and make it successful at the end of the day, then that was my biggest confidence that we can control costs and still make it effective.
Thank you. That's a very, very inspiring note. And I will, with the same thought, I'll move on to Dr. A.V. Gurava Reddy. And so you've often spoken about, delivering world-class care at Indian prices. So what operational efficiencies or models do you think can be adapted to really make that true?
I'm unable to hear you properly. The speakers are that side.
Okay, I'm saying that I'm extending that question to you as well. You've often spoken about, providing world-class healthcare at affordable Indian prices.
Yeah.
So how do you think is that scalable, and what model can really work for us?
Yeah, as my colleague and dear friend told that, I would always believe that there is one adage I always love to recapitulate. Any healthcare industry or a healthcare facility should be big enough to serve and small enough to listen. That is always my thought process. So the affordability comes from the concept. Because the MR scan costs 10 crores, you don't need to charge 10,000 rupees to the patient. And again, the second is, it is in the numbers. And third point is, healthcare delivery cannot be seen return on investment. There is a fundamental problem with some of the entrepreneurs or the people who put money in the healthcare, the ROI. That is a very wrong concept. The return of investment is not there. The services are entirely different. The experience is entirely different in the healthcare. And affordability comes from the concept, number one. And number two, optimizing the compromise. That is another buzzword for me. When I came back from England, a lot of people said, you can't practice in India without cutting the corners. I said, cutting the corners is different. Optimizing the compromise is different. So if you go to Western countries, humongous money, I'm sure Guru will agree, is wasted in the theaters, in the OPDs. Here you can optimize that. And here our efficiency in running the operating theaters, in optimizing the infrastructure or optimizing the consumables is 100 times better. That's why the value for money is much more here. And that is the key word to make it affordable. But first of all, you should have in your heart, not in the brain, that it should be affordable. All the things can be afforded to them.
That's very interesting to hear, and especially because you both have been on both sides. You are doctors as well as managing hospitals. So that's very inspiring to hear. I move on to Mr. P. Hari Krishna. And so given Medicover's, European background and India expansion, what are the designs and planning that you are getting into to really make it an India model?
So before I answer this question, I would like to thank the Times Group and also tell you I'm honored to share the dais with Dr. Guru Reddy and Mr. Subramanyam, also along with my mentor, Dr. Gurava Reddy. I never thought I will share a stage with him here. Thank you for making me part of this. So, Medicover is a European healthcare chain having presence in over 14 countries along with India. Where we have 6,000 beds spread over 4 states. So the investment, as Dr. Gurava Reddy sir was telling about, return on investments, you should not look at it. You should look at more from the passion point of view. That's where when we had a choice of raising money from a private equity versus a strategic investor, we went with a strategic investor because private equity most of the times come with the return on investment and the time horizon where they have to exit. So when we chose Medicover partnership and aligned with Medicover in 2017, from there it really helped us because we from India bring on the table the best doctors. Nobody can match the expertise of doctors like Dr. Gurava Reddy with the kind of volumes he manages, with the kind of skill he brings in. But, the European chain will definitely help us in lots and lots of other things like detailing, audit process, construction quality, or be it efficiency in air conditioning system or many other activities which Europeans have pioneered, and when they couple with Indian skills and Indian way of working or bringing in the cost efficiency, that is proving us and that is helping us to establish better and grow faster.
Thank you. I move on to Mr. Subramanyam, and we all know that Apollo in some way has led the digital transformation in healthcare. So how do you see that infrastructure complementing physical infrastructure?
Thank you so much. First, let me thank Times Network for inviting us, and also I thank my co-panelists. In fact, I worked with Dr. Gurava Reddy, I worked with most of the people here. I also thank the audience to willing to listen to us actually. So, digital transformation, it is something which India requires at this point of time, world requires at this point of time, because the accessibility and equitability of medicine comes only through digital at this point of time. Because India is a very, very vast country. We can't expect at every nook and corner there is a specialist available and doing it. So digital infrastructure, by developing the example like telemedicine, tele-ICUs, e-ICUs, these things would complement the physical infrastructures which are available largely in the cities. Say for example, we run a lot of telemedicine centers in Himachal Pradesh where, it's very difficult to even travel. But, we could able to do lot of tele-emergency cases there, tele-ICU cases through this particular thing. So there is an infrastructure, the hub available here physically, but at a telemedicine, at a telemetry level, we will be able to do this particular thing. So the equitability and accessibility can come only this. But I always tell, it cannot replace a doctor. Nothing, no technology in this world can replace a doctor and a nurse. This can only complement them. So if anybody thinks that, one day, will only the technology will treat the patient, it doesn't happen. It happens only there. It's always Vaidyo Narayano Hari, God. Doctor is always a God. So we always respect that. And this particular technology should enable and give that access to the doctor to treat more. That accessibility can come. So this physical infrastructure and the technology married together would be able to, we will be able to treat more patients with more technology innovations. This is the future.
Rightly said, we cannot ignore digital and definitely not do without doctors. Yeah. So, Dr. Reddy, my next question would be to you. I mean, you are in a panel and how can we not talk about gastroenterology? So I would like to ask you that, we've seen rapid advancements in terms of minimally invasive procedures, AI-assisted surgeries, diagnostics. So what do you think India needs to do to really become a global hub in terms of, for high-end gastro care?
India is already very well recognized for its physician fraternity. There was a recent, I think 2024, assessment of the physicians of which countries of the world are at the top, second, third, fourth, and fifth. I'm sure the audience are aware. If not, they'll be surprised. After the United States of America, Indian physicians have been voted number 2 in the world. And after the number 2, Germany, UK, rest of the European countries fell in place. While we enjoy this great reputation, unfortunately, we are challenged with a very chaotic healthcare system, where we are ranked in the Global Health Security Index 66, where we are ranked in terms of accessibility and quality of healthcare 165 amongst 195 countries. So while we face this battle in terms of our recognition globally, while we have an extraordinary physician pool, not only the physicians in this country, but our doctors, made India shine wherever they have been across the globe. To answer your question, we have never been shy in embracing and adopting technology, particularly the last decade. Today in India, after spending 4 decades in America, where I still travel every 2 months, I have been a leader in many societies and organizations there. I could see the difference between the two countries in terms of how India played the catch-up game. There is no metropolitan city of this country or any urban healthcare center where a hospital is not equipped with almost all of the technologies that a US hospital has, if not more. So we are talking about surgical instrumentation, imaging instrumentation, the onset of robotic revolution that is happening. So we are there. This will be our century. We are catching up at a rapid rate, and there is no dearth for investment in terms of these technologies. But the unfortunate and the sad story is that only 26% of the rural India is equipped or have some sort of basic technologies. So we cannot live behind 600 to 700 million people while we enthrall on these bigger hospitals, urban technologies, and accessibility to a fraction of the population. So somewhere or the other, if this divide can be bridged, we can be the greatest nation in this world. So I think technology is important, but use of technology is also important. I think if you focus on technology as a rate of investment at the end of the day, and just getting something to do something to make money, I have completely, detested all my career from west to the east. So we have to be careful when we are really adopting a technology of how well it will serve a patient. One last example to give. For the last 20 or 30 years, we have witnessed a dramatic transition in the surgical approaches to human disease. From open surgery to laparoscopic surgery, in today's world, minimally invasive surgery to robotic surgery. The question we ask is, does every patient who walks into your clinic or hospital, does he require or deserve a robotic surgery? Does everybody require a minimally invasive surgery or a laparoscopic surgery? These are the questions ethically one need to address. There is no point in putting a patient into unnecessary dire stress by offering him something which is not required, which is still relatively emerging, where we are still going through a process as to which is the best tool. So one has to be cognizant in deployment of these technologies to the point that to the point of realization that in India, affordability, accessibility is still a great challenge. And if you're mindful of that, I think we can use the technologies properly.
Thank you. And just again, related to affordability, my next question would be, India performs a growing number of joint replacement surgeries, and yet access remains limited outside of urban hubs, as we know. What do you think can be done in this space to really make that accessible for more people?
Joint replacements?
Joint replacements.
Yeah, my forte.
Yes.
Okay, yeah. I do, when I came to India from England 25 years back, my first job was in Apollo, when Subbu was a young marketing man. And we have traveled a long way. The first year, I think there was probably around 100 joints done in Hyderabad. Now I myself do 4,000 joints per year. One of the largest numbers in joint replacements is India after America. We are the leaders there. But unfortunately, as I say, for every one joint I do, there are 10 people who can't afford a joint replacement. And joint replacement is one of the few branches where the success rate is very high, but the consumable cost is very high. Because the implant costs so half of the price. But thanks to Prime Minister, the prices are cut, and now it is almost 30% cheaper than before. But having said that, still there are millions of people who can't afford that. But again, thanks to the government schemes, there are with the Prime Minister scheme and all that, joint replacements also done in that gamut. And now, from my point of view, I said every surgeon's life is in 4 decades. First decade is learning, second decade is earning, third decade is teaching, fourth decade is giving. I am in the 4th decade. So we have started a Sarvejana Foundation in which we got a scheme where we put the knee joints to the poor mothers. So the slogan is one for mother, one for other. So you give one joint to your mother and donate one joint to other. So we have done already around 200 joint replacements, but it's a small drop. Many, many more people to be coming on board. But I'm sure with the insurance schemes, with the government initiatives, with the awareness is caught up tremendously well. So we have gone forward. And again, as Guru was saying, the robotic joint replacements, we are the leaders. But it doesn't mean that robotics is the God's gift to the joint replacement. No, a manual joint replacement is as good as a robotic joint replacement. But robotics has got some marginal advantages, and that's it. So, but your question is very appropriate. The joint replacement is a lifestyle changer. It is not perceived as a lifesaver, but is a lifestyle changer. But I have seen many women in our institute. We have seen one tailor woman. In COVID, she lost her husband. She could not do the tailoring because of the arthritis. We gave her new joints. Now she is able to earn her bread. So like that, so many stories where the inability to walk to the toilet is humanly so degrading, and that you should really address. And joint replacement has to be a part of regular health care.
Thank you so much. Mr. Subramanyam, my next question would be to you. Since we are talking about, affordability and as well as ethics, like both the doctors pointed out, with Apollo's pan-India footprint, what are the biggest roadblocks that you see that, that makes this healthcare and this reach a little difficult in the smaller cities?
Can you just repeat? I'm not able
Yeah,
to.
I'm saying that.
Can you turn one of the speakers this side? Because it's absolutely incomprehensible.
Yeah, not very difficult.
Okay, I'll repeat that with Apollo's pan-India footprint, what are the biggest roadblocks that you see in terms of infrastructure development in smaller cities, in tier 2, tier 3 cities?
Okay. It's a It's, yeah, actually. It's a really beautiful question because as you very rightly said, we are pan-India, we have across entire India and almost about 80 hospitals now, bigger hospitals. We also realized at this that, tier 2 and tier 3 cities, when we wanted to do something like what we are doing in Hyderabad, it is not possible, tier 1 cities. So we have come up with a model called REACH, Apollo REACH Hospitals. It is a model where it is fit into the infrastructure wise, the budgets wise, the way we operate. It's an operational efficiency fundamentally. These things are slightly modified and understood, innovated fundamentally to suit the tier 2 and tier 3 cities where we will be able to offer the same quality of medicine but in a different way of doing operational way of producing these results. The results are absolutely same, the outcomes are same, but it's a basic innovation. We operate in a smaller environments there. We use lot of tele-technologies there. If we really look at the very remotest villages, we should be able to serve, as Dr. Guru Reddy said. It's important that we cannot say that that population we will not. So we have to innovate these products. We have to innovate the technology in such a way. We have to innovate the entire infrastructure in such a way. We have to train our people, personnel to deliver such deliverables in those environments. So it's a great study. I can talk days together on this subject because I was involved in creating these models from the beginning, in various rural population, whether it is telemedicine, whether it is, the rural clinics where we operate in AP and all. It's a beautiful subject. We need to have that vision that yes, we should treat these things, and we create infrastructure accordingly. We create entire delivery system accordingly. So challenges are there, but they're not impossible. We have seen this happening. I think, sir, you want
Dr. Reddy wanted to add something.
The biggest roadblock of developing the healthcare in tier 2 and tier 3 metros is the wife.
Please elaborate.
Because you see, the children need a good education. Let us say, example, you take a gastroenterologist or a cardiologist or an orthopedic surgeon. We will ask them, boss, you go to the tier 2. The next day he will come and say, I won't go. Because his wife says, what about children? What about children's education? Because that's important, isn't it? So that is the main crux. Because the tier 2, tier 3 do not have a proper educational institutes matching this one. So that is aspiration number 1.
Yeah, I think this is the first.
Yeah.
We have never heard this.
That is a practical
before.
reality which we see, isn't it, Guru? Yeah, very, very relevant point. And so the wife and children decide whether this doctor will go there or not. That is the biggest stumbling block. How to solve that? I don't know.
So it must be your last question to me. I just want to congratulate every doctor here for and every healthcare professional for getting these awards. Thank you so much. Very honored to be a part of this group.
So before we end this panel, I would like to throw a question across to all 4 of you, and maybe you can start with it. That, how do you see the overall healthcare system in India evolving in the next 5 to 10 years?
If you see healthcare over last 1 decade, or if you see the kind of listings which are happening pre-COVID and post-COVID. Pre-COVID, there was only one Apollo hospital or 1 or 2 others which were listed. Now you see the maximum DRHPs which are getting filed with SEBI are healthcare. So this is one such indicator that healthcare has a growing interest. Healthcare, there is a growing need, and healthcare is going to be the future of such a large country like India, where you have 1.4 billion population, which needs a proper healthcare, which needs a quality healthcare, and which also needs a affordable healthcare. So over last 5 years, if you see the number of hospitals which are expanding, the number of beds which are coming, which will clearly indicate that this sector will definitely grow leaps and bounds. But there is a scarcity in getting, the doctors. It's not just wife, it is also mother-in-law, father-in-law, father, mother, all plays the role of starting a hospital in rural. Because we run hospitals right from Srikakulam, which is a remotest place of Andhra, here, Nizamabad to Warangal. Warangal, we are the only corporate chain which have entered. So we encounter this problem every day. So this is a genuine issue. But the whole family also plays a role, and also the infrastructure. There are no hotels, there are no pubs, there are no other place, or not just schools, because everyone wants their social life need to grow. So the healthcare has to literally reach to the rural. Because if you see Hyderabad, the place where you are sitting, if you draw 10-kilometer radius or even 5-kilometer radius, there are 6,000 beds which are operating. Nowhere in India we have so many hospitals. But if you see the rural market, many cities, none of the chains have entered or even thinking of entering. So healthcare needs to move towards the direction of going to tier 2, tier 3 towns. Then the load on the cities also will get reduced.
Thank you. And I know the time's up, but I would like to hear your thoughts as well.
Good. Thank you, Hari. I think you're very well illustrated. On an optimistic note, we have a fantastic future. The fantastic future lies in the fact that we see new hospitals being announced, new medical colleges being announced, and our distinguished IMA president earlier today in his keynote address did mention the goal and ambition is having, one hospital per each district, so one medical college per every district, and all of those things. Okay. Prime Minister Modi, I think in his very first term, has doubled the undergraduate medical education in this country from 55,000 to more than 1 lakh, or today it's about 1,20,000 MBBS graduates. He has also doubled our postgraduate education. We are basically today about 60,000 from 35,000 people. So the crunch of human resource in terms of the physicians over a period of time, probably in a generation, I think we're going to overcome that. Probably the world will be quoting about India's physician-patient ratio rather than quoting the World Health Organization. I'm extraordinarily confident, as the Prime Minister, as I quoted a few years ago, he wants to see Indians in all the 195 countries of this world to be practicing and controlling the healthcare. And with this kind of production, I'm extraordinarily, optimistic. But let me just reflect on the realities. Is that simply production of the doctors is going to address this issue of competent healthcare in our country? The answer is no. We have to focus on the healthcare spending and healthcare budget. As our IMA president has mentioned, with 1.8% of the entire GDP being spent on healthcare is extraordinary paltry. Today, when we compare to our neighboring nations, in terms of quality and accessibility, India ranks lower than Bangladesh, then Bhutan, then Sri Lanka, and China. It's very shameful. It's absolutely shameful. So we are focusing on entrepreneurialism at the end of the day, major metropolitan cities, private equity investors, and changing hands, and listing of IPOs, and robotic technologies at a point when we are really kind of missing the larger segment of a population. So increasing the spend of the government is absolutely a crucial need for our country. We are the lowest. If India wants to leapfrog, as our Prime Minister says, to become the developed nation by 2045, we cannot be doing with 1.8%. All the developed nations of the world, they are spending more than 10% of their GDP today. Yes, they may not be the best. You can say that America, with $4.5 trillion, still ranks, as 34th in the world, but nevertheless, they're taking care of the people. Do you know what is the healthcare total expenditure of India? It's 3.6% of the GDP. So here is 1.8% the government is spending, but the actual expenditure is 3.6%. So where is this coming from? Who is bridging this gap? unfortunately, the out-of-pocket expenses, where people are going through catastrophic, spending and liquidating, and so many things are happening. Now, the other last thing I want to reflect on, many times we think that hospitals are gouging, they have to spend so much, doctors are charging, the salaries are very high. Many of these things might be true. But end of the day, if you look at what an average Indian family spends on education, an average Indian family spends on leisure and vacation, and an average Indian family spends on healthcare, you'll be surprised to see this, you're surprised to know the statistics. We spend less on healthcare, an average family, than their education, than their leisure and vacation. You'll all be surprised to know that. So, our per capita expense, which means to say that individuals and families have to give more attention to their health care. And how can they do that? Focusing on prevention, following the doctor's advice, taking the medications right, and do not wait till the end stage of the disease and when they are basically transitioning to a catastrophic stage and burning lakhs and lakhs of rupees and becoming a burden. So individual responsibility is extraordinarily important in this whole journey for our country to emerge, to one of the great healthcare destinations. Thank you.
Very important point.
Yeah, I am excited. India is going to be good in the next decade for 1, 2, 3 reasons. Infrastructure is getting better. The awareness of the people demanding for a good health is getting better. Government is doing definitely proactive. As Guru said, the GDP has to be spent more, but the days will come, definitely. And accessibility is getting better. Telehealth is getting better. So I see all the positive things. Next decade, 20 years, we will be definitely able to cater to all the 140 billion people with a good outcomes.
I have only 4 words. One is, future is it's going to be predictive. It will be more predictive. It will be more innovative. It will be more accessible. And it is more inclusive. I think these are the 4 things which we can predict.
Thank you so much. Here's to good health. And thank you, panelists. It was a lovely discussion today. Thank you so much.
May I please request our panelists to please stay back on stage. I request our speakers to please remain on stage just a little longer. I request all our speakers to please remain on stage. Exhilarating and enlightening indeed. What a power-packed discussion that was. Now may I please welcome on stage Ms. Pooja Sethi, Managing Editor, Digital Times Network. I request our speakers to please come back on stage. Our speakers to please come back on stage. Yes, I invite Ms. Pooja Sethi, Managing Editor, Digital Times Network, to take this moment to present a token of our appreciation to our esteemed panelists for taking out time from their busy schedules, being here with us today and sharing their thoughts with us on this wonderful platform. Can we please give them a huge round of applause? I request our dignitaries on the dais to please come together, our panelists and Ms. Sethi to please come together for a group photo opportunity. Once again, let's have a huge round of applause for them, please, ladies and gentlemen. Thank you, ladies and gentlemen.